that's one of the things we've actually tried to look at. That it's a hard thing to look at because, again, most of it we would have to do it prospectively. But I think from a clinical standpoint, from taking care of patients, and very anecdotally, I think for those of us who take care of patients of different ethnicities, patients who have darker skin, ironically, do tend to have worse skin reactions than those with lighter skin. So you would anticipate that, for example, a patient who's got really light skin, they'll come in and say, well, I'm really sensitive to the sun. I'm going to be very sensitive to the radiation. It's actually not the case at all. The darker skinned patients actually do a lot worse. They do tend to have more toxicity. So it could be that it's the melatonin within their skin, or a variety of other things that we're not identifying. But I think that's going to have to be looked at very carefully. So I do tell my patients that have darker skin that there's a possibility that their skin reaction is going to be worse than the average patient that we treat. But nowadays, with three-dimensional treatment planning that we do, and using field and that kind of thing, we're able to diminish that quite a bit. So it's not like they're having moist desquamation, grade 3 moist desquamation. It's just the hyperpigmentation is pretty pronounced in patients with dark skin.